I've been reading and listening to the news. Does everyone think that solving the shortage of beds and ventilators is all that is necessary to save COVID-19 patients? There's hardly any public discussion that the patients in those beds and on those vents are only going to be able to live if they're highly qualified nurses to provide the extraordinary amount of critical care it takes to save them. Before the crisis began, most nurses were already overworked, in large part because the business executives who now run hospitals don't seem to understand the life-saving value of nursing work. And so now COVID-19 is resulting in unbearable burdens to nurses. Solving the ventilator shortage will be easy compared to solving the nursing shortage we now face. You've probably heard ideas about how we can stretch our equipment, for instance by connecting 4 patients to 1 ventilator. That's great, but we have a limited number of nurses, and training new nurses takes many years. How can we ensure that every COVID-19 patient gets a nurse and that nurses do not break under the stress of having to provide care for so many patients? We propose reinventing hospital workflows so that the medical assistants who now perform clinical care instead ask to ease nurses' administrative burdens, which will only become more acute in the COVID-19 setting, or time-consuming infection control procedures are critical. Some have proposed other promising measures to ease the nursing shortage. These include recalling retired nurses to the bedside and accelerating the graduation of senior nursing students. Others have asked physicians and medical students to help out in ICUs. That help is commendable and needed. We do note that despite physicians' advanced training, nurses know things and do things that physicians do not know and do not do. So we urge physicians to work in partnership with registered nurses to make sure all of the nursing work is competently identified and performed. One measure we can't support at this time is radically increasing the number of nurses who are recruited from overseas. We see real ethical issues with drawing nurses from countries that cannot afford to lose them, especially during this global crisis. Nurses are one of the world's most valuable resources. Let's do a better job at sharing them. But with all of the extra help, we will still be very short of nurses. So let's strategize about how we can maximize the delivery of nursing care when nurses are under the crisis of their lifetimes. Let's stop wasting nurses on clerical work. Some background might be helpful. In the 1990s, business executives began placing medical assistants in the clinical setting to take over some of the work that nurses had long done, in order to reduce the cost of paying highly skilled nurses. Instead of nurses doing frontline surveillance, which includes vital signs, medical assistants now began to take vital signs, and hospitals started hiring fewer nurses. But medical assistants who may have a year or less of education after high school are not educated to detect the subtle signs of deterioration that nurses can see, hear, and feel. So they generally don't know when a patient is crashing until it's quite obvious and it's too late to save the patient. In addition, the automatic vital sign machines that medical assistants rely on are deeply flawed. I have often seen them malfunction, registering heart rates and blood pressures much higher or much lower than they really are. Once I saw a machine detect a healthy blood pressure on a dead man. But even if the machines can't be trusted, registered nurses can still detect subtle symptoms that signal a patient is in decline. That is why only nurses should be doing frontline surveillance. In addition, we all know there is a limited amount of personal protective equipment, or PPE, such as face masks. To conserve PPE and reduce infection of healthcare workers, only one person, the nurse, should be crossing the infection control barrier to be with COVID-19 patients on a regular basis. So let's reinvent the workflow and ask medical assistants to ease the enormous administrative burden that modern nurses endure. Imagine if nurses could spend all their time at the bedside and medical assistants could be recording the assessments that they call out, send labs, pick up prescriptions, recall historical data, complete paperwork, retrieve supplies and bring them to the clean/dirty line, and facilitate communication with physicians and other members of the healthcare team. Then nurses can remain at the patient's bedside, reducing the enormous amount of time it takes to go back and forth between clean and dirty, removing gloves, washing hands, coming back in, donning the PPE. All that takes so much time that doesn't have to be wasted. Instead, nurses can spend their time conducting skilled monitoring of patients, implement high-tech care, and provide vital psychosocial support. Very few tasks nurses do away from the bedside requires a nursing education. So why have nurses do them? Let's give every nurse one or two clerical assistants so that they can stay where they are needed, at the bedside. Why hasn't this been done before? Actually, it has. Nursing leader Lydia Hall implemented a version of this care structure at Montefiore Hospital in New York in the 1960s. Only nurses were allowed to touch patients. The nursing assistants helped the nurses, not the patients. And this model worked very well. All the care patients received was delivered by a professional. Sadly, this model did not catch on, probably because it conflicts with long-standing stereotypes of nurses as unskilled handmaidens. Even today, news stories on healthcare generally ignore nursing, as the recent Woodhull study revisited will tell you. Nurses are quoted or used as sources in only 2% of health articles. And influential media like Grey's Anatomy and other television shows continue to stereotype nurses as peripheral helpers, except for Call the Midwife, which is fabulous. These stereotypes obscure the reality that nurses are and should be at the center of hospital care. So many people see nurses as virtuous, unskilled helpers who reside at the bottom of the hospital ladder. Someone with that view might well wonder, how could a person at the bottom of the ladder need or deserve an assistant? They are the assistants. But that is such a wrong way to think, which is why we at The Truth About Nursing fight these stereotypes every day. In fact, nurses are college-educated science professionals whose decisions and interventions make the difference between life and death every day. They are fully deserving and needing of assistance. So let's act now to reduce the burdens on nurses. Then nurses can use their skills to solve clinical problems. That way they can save more lives and get us all through this COVID-19 crisis. Be brave, be bold. Please work to restructure bedside care at your hospital so every nurse has at least one assistant to provide administrative support. After all, lives depend on it more than ever.